Now, Dr. Yoav Yehezkelli is a specialist in internal medicine and medical administration, as well as a lecturer in the Emergency and Disaster Management program at Tel Aviv University, and he joins us now with more. Doctor, a pleasure to have you with us. Now, this report is being criticised by many in the medical field as unreliable. What's your take?
Well, as a matter of fact, I try to follow the data that are in that report, and unfortunately, they are not very transparent. I mean, there are some data there that, looking at the data of the Ministry of Health that is published, I didn't see exactly the same numbers, so it was a little hard for me to follow it. And so I cannot understand exactly, as a specialist in the field, the connection between the data and the conclusions. Although I must say with some of the conclusions I agree, especially the recommendations to keep on hygiene and social distancing and wearing masks, especially in closed environments. However, regarding the amount of new ill people and the cases, I think we are not in a second wave.
So then you, of course, have worked yourself for 17 years, until 2005, in the CBRN medical branch of the IDF Medical Corps headquarters. So you're aware, of course, of the system. So what then does a report like this help us with? What information can we glean from it?
Well, I think it is good that people are looking at the data and trying to analyze it in real time. That is an important part of any preparedness and any response to a scenario of an outbreak, which is what is happening right now. However, it is not less important to have a mindset of openness and transparency. And I think that I would like very much to have the new general manager of the Ministry of Health, which I'm familiar with, open the data to experts from the outside and open the data for people in the academia, so we can also make our conclusions and our analysis of these important parameters.
So you're saying that you don't believe that we're in a second wave. Does this have to do with the fact that we've seen increased testing then? Does this give us a false sense or a better sense of where things stand regarding coronavirus?
Definitely. We are now testing about 3 times more than the testings that were done in the beginning of the first wave. So this has, of course, an impact on the number of confirmed cases you find, as well as the finding that at least half of them today are asymptomatic. So, and as we know, there are many asymptomatic patients with coronavirus, and this is actually quite a good phenomena. On the other hand, they can infect other people, but on the other hand, they are become immune. So I think that as long as we don't see many cases with severe illness and the people who are ventilated, then we are on good ground nowadays.
So we're hearing calls from the government to perhaps reimpose some restrictions, and there are many people around the world who are comparing the coronavirus, for example, with the flu. They're pointing to the underappreciated toll of the flu, which also causes thousands of deaths every year. So tell us why these restrictions are important in controlling the spread of coronavirus, and why perhaps that's not important in seeing those same precautions being put in place when it comes to other viruses like the flu.
Well, for the flu, we have a vaccine. So although each year the number of deaths, the death toll from influenza is actually quite similar to what we see now with the coronavirus. Coronavirus is completely different in that it has a high variability in the severity of the illness. In young people, it is usually a mild disease, very mild disease. However, in elderly, it might be very dangerous and lead to mortality. So this is something we have to take into account when making a policy and decision making. This is for once. And the second thing is that because we don't have a vaccine and the contagiousness of the illness can happen also when the disease is still asymptomatic with coronavirus, then the importance of all those measures of social distancing, wearing masks, becomes very important. However, I must say that regarding masks, those are most important in closed spaces. In the open air, the value of wearing masks is much lower because the risk is much lower.
All right, Dr. Yehezkelli, thank you so much for that insight there.
You're welcome. Have a good day.